So first of all, you should be aware it's 17% of the GDP, not health law, healthcare. Probably going to be 20% of the GDP in the next decade. So that's a lot of the economy. And the good thing is when you're a lawyer and you think about things like 20% of GDP, that means you're going to be busy. And the other piece is it's not even just 20% of GDP, it's GDP that's in rapid change. And my husband, who's a tax lawyer, every time people say to him, you know, what are you going to do about a flat tax? He always looks and says, change is good. Well, if change is good, you can just imagine what it's like in health law. You know, sometimes I, as a professor, disagree with that because it's hard to keep up. But it's nonetheless good for all of us. So, what does it cover? It covers things like food and drug law, bioethics, mental health law. Every time there's a tragedy like Virginia Tech, we're right at the center of things. Medical malpractice, which is what people traditionally thought of as health law. Biotechnology, genetics, all sorts of industry work. So people tend to think sometimes of health law as what's going on in government, but if I'm talking about 17% of the GDP, that means a huge amount is now business health law. Now, at UVA itself, we have some of the strongest scholars in the field working here. One of the things that's really pretty neat about our program is that it's interdisciplinary. So I and a number of my colleagues actually have secondary appointments at the medical school. I have colleagues at the medical school who teach a lot over here. I also teach in the business school, and I teach in the public policy school. So that gives you an idea of how it works. There is a lot of interaction, even though you may actually discover that it's a little harder to get to than you might hope, and we're working on that. So, Richard Bonney, who is one of my mentors, is one of the top scholars in mental health law, criminal law, the intersection between that and substance abuse, and many other areas. Every time there's a crisis, he's on the news. We have the strongest ethics program, I think, in the country. Some might disagree, but Jim Childress, who's here in religious studies and the Institute for Practical Ethics, and John Arris in philosophy practically invented the field of bioethics. If you read Jim, ever hear about the principles of bioethics, Jim was one of the co-authors of that book in its original and continued iterations. We have a joint MPH JD program, which some of you may even have already entered. If you haven't, you can consider that and enter into that in the spring of your first year. You can apply for that. I will tell you the hard part of that piece you have already done, and that's getting into law school. So if it interests you, you shouldn't allow that piece to distract you. And what that allows you to do, which isn't that common, is have a top 10 law school degree with an MPH. And that's likely to become a very effective combination. Then the last piece is more subtle. It's very important to realize that health law is actually still part of law. And so if you're thinking about what is a great health law program, you actually have to think of what the other faculty is doing. You actually can't do health law without constitutional law, administrative law, insurance law, all sorts of other areas of law. And the synergy that that creates for me, working with my constitutional law faculty, for example, where I'm not a religious studies expert. I'm really not. But I had to actually learn a lot of religious studies in the last couple of weeks because of the Obama contraceptive mandate. That allowed me to go talk to my colleague Doug Laycock, who is one of the top religious studies scholars in the country. And as a result, he doesn't know much about health law. I don't know much about religious studies, but we're able to put it together. So, we offer courses that range from a broad survey class, which I actually teach. It's called Health Law Survey. So easy to figure out. That class is good for both people who want to take maybe one class in health law, and this is it, they actually want to be introduced to a lot, or perhaps someone who's an expert, may even have a master's in bioethics or something like that, but wants to know what the rest of the landscape looks like so they can pull it all together. And so we actually set that up so it's available for first years in the spring of their first year, and can be a jumping off point to other classes. But then we have food and drug law, we have bioethics, we have medical malpractice, we have genetics, all the way from all those specialty areas into even sometimes short courses that last 1 week, where we usually bring in an alumni or someone else, an alumnus or someone else, who's a real expert in a very small specific field that you might be interested in. And then they have a short course that you would take for a short part of the semester intensely through that week. And some of those go on 1 week, some go 2 weeks. We have a wonderful biotechnology short course, for example, with someone who actually can tell you what it's like setting up a biotech. So you'd actually have hands-on experience. We also have a January term class in Israel. We have several J-term classes, but a January term class in Israel, which allows you to go to Israel. It's focused on bioethics. It's actually led by one of my colleagues who has an appointment here and in Israel. He's also, he's a master of many things. He's actually also an MD as well as a JD, US JD, SJD. And so what you can do with that is actually experience bioethics in a very different culture. We don't necessarily think of Israel as a very different culture, but in the context of bioethics, it's really different. So what else to tell you about? We have conferences throughout the year, both here and in the med school and at Darden. And one of the best ways for you to know about those once you're a law student is through the Health Law Association, which has a listserv that lets you both know about conferences that it itself is sponsoring, but also I'm the faculty advisor to that organization, and so I feed them everything else going around grounds. And frankly, you can also find some just by going through the UVA website. But there is an amazing amount. There is a conference every single week at the med school on really neat issues that you might not have thought of. We have quite a number. We're in 2 weeks, we're about to have a conference on law and business in the healthcare sector, which will bring in a number of our alumni and major people, for example, general counsels of major hospital systems, then a community hospital CEO, people running major pharmaceutical companies, and different types of industry-oriented things like that, and having a full day conference looking at some of those issues. And that we're co-sponsoring with Darden, so it's really got some interesting pieces to it. Next year we're actually talking about a 4-day conference on genetics. The first part looking at some of the issues that go along between physicians, geneticists, and us, and then the last part being a fairly intense workshop with faculty in law and bioethics. So this is another opportunity for you to be exposed to exciting cutting-edge issues. But those are just examples. We actually run it through the whole year. Now, another question I often get is, so where do your students go? Because presumably you're not here just to visit me. So where do you go? It's amazing how many places you go. We're a top 10 law school, so many of our students still go to firms. That's not a bad thing. I worked in a firm. I actually loved it. So when you hear people tell you don't go to a firm, they're wrong. It depends which firm. It depends what you're doing. And so in health law, it depends what you're doing in health law. So for example, if you're doing FDA law, many of those firms will be in Washington. They're often some of the most prestigious firms. If you're doing hospitals, on the other hand, some of it may be in Washington, but then it may be all over the country, because hospitals are all over the country. You may end up going from that type of thing to being a general counsel of a hospital, or working within a system in another fashion on the business side. You may be in government. We have, actually I was looking through the FDA website just on the employee side, and it is still stunning how many of our alumni are at FDA. Part of that is that one of the chief counsels of FDA was my mentor, Dick Merrill, and he has taught more future FDA lawyers than anyone in the country, I think. And they are intensely loyal to him, which is good because that means they're intensely loyal to UVA. And so we have a nice synergy going with them. But it's quite beyond just FDA. We have lawyers all over HHS, all over government generally, who have taken health law classes. One of my students who graduated probably about 10 years ago was recently the director of the President's Commission on Bioethics. So that gives you a taste of how many different places you can go. We have lots of students in industry. It's not a typical path to go straight from law school to industry. Usually you go somewhere else, get more training, but that world is changing a little bit. And so some people are going straight into industry, especially pharmaceutical companies, things like that. And then finally we have people in academia, which I recommend highly.